And so here we are on Beyond the Book, the podcast, talking about, the book's success. Specifically, we're going to dive here in now to your contribution to the book entitled chapter 10 in the book entitled Higher Ground, the transformative power of the Big C Reattitude. So I want to get into this. I want to really learn not only what your contribution specifically was, but why it was so important for you to share this story and this knowledge and what you hope people take from it. So take us through this. What is your contribution to the book? Why did you feel that urge to want to be a part of this?
So interestingly, as everything else in my life, I'm open to just different paths as long as it's going to lead to more enlightenment for myself and then, of course, to be disseminated to others. So when this opportunity presented itself to me, I had to determine first. The title of the book is Success. I could have delved into so many things. I could talk about my path to success or what is considered success. But I really defined success as finding your calling, right? So because success means you are fulfilled. Once you know what you're placed on earth to do, at least one of the assignments, then you feel fulfilled. And I define that as success. So then the question was, what do I include in this chapter? And my patients are my teachers. They inspire me. So it was quite easy to then select a topic that I wanted to include in the book and delve into that. And higher ground, it really just defines or it encapsulates an upliftment of the people around you such that they can be more enlightened. So it's from a baseline to a point that is higher than what you even think of yourself as being capable of, right? And so that's really what I thought of as higher ground. Now, my patients, as I stated before, I admire for so many reasons because they're going through such a difficult time in their lives. So I thought about the level of strength it takes for my patients to go through what they go through every day, the courage, and also what they learn from the experience, but what I learned from them. And in observing my patients, I realized that I did not have much time to address a certain phenomenon that I was observing in my patients, and that is psychological toxicity, where patients can tend to lose hope. Their mind is in an upheaval, so to speak, as you can imagine. The day or weeks prior to being diagnosed with cancer, they're going on with their daily lives, not knowing that they are going to be told that they have this big C, right? And so there is everyone reacts differently to this news, but regardless of how you react, it's not going to be a pleasant moment. In fact, it's life-changing, it's scary, it is intimidating, and then and there you're facing your mortality, and the future is no longer tangible to you. You don't see beyond that day, actually. And so I decided that I realized in retrospect that I have been addressing these psychological toxicities without even naming it as such. At the time, it didn't have a name, the Big C Reattitudes. So I mulled over this for several months and realized that I was applying a 7-pronged algorithm to address these toxicities. And so these I have an acronym for, which once the book is released, you'll see it's really HIS LAMP, as in HISLAMP, 7, right? Restoration of hope, reclamation of identity, reaffirmation of self-worth, and then of course there's the reappraisal of life, the just the requited admiration, meaning my patients admire me, but I also admire them, right? And then there is the rehabilitation of the mind and the reignition of purpose. And I'll define two of those for you because it's going to be a lot to just explain all of the Beatitudes and what it really means in a clinical setting. So, for example, a patient who has undergone mastectomy, sometimes double mastectomy for locally advanced breast cancer. And then they are sent to me after adjuvant chemotherapy to discuss and then undergo post mastectomy radiation therapy. Those patients are treated for approximately 6 to 6.5 weeks, and that's every day, Monday through Friday. So I'm seeing my patients once a week, sometimes more than once a week, just depending on how much they need to discuss any side effects that they're experiencing during the treatment. And what I discuss with my patients after addressing their side effects, I read their visage and I ask open-ended questions. Why? Because medicine is not just about treating the cancer. That's not how I view medicine. It's about more than that. And as I stated, I saw that intimately in the treatment of my mom, where you can go beyond that and reach others, reach inside the patient. The patient feels vulnerable enough and they may not want to disclose certain things. And what I've noticed is I actually published a podcast called No Apologies, because patients tend to apologize if they believe that they're taking your time, because they respect your time. They know doctors are quite busy. And so they don't want to burden you, so to speak. They don't understand that that's what they know, that's what I'm here for, but they believe that if they discuss anything outside the realm of medicine itself, cancer itself, then that is a burden for the physician. But that's not my view. My view is, if I'm taking care of the whole patient, addressing what is tormenting you mentally or psychologically in that moment, it will help you to, one, to allay your fears, and two, to be compliant with treatment. Because what we don't understand is that any obstacles, mental especially, can affect the outcome. And if a patient decides they've lost hope and they don't want to undergo treatment anymore, then of course your treatment outcomes are going to be inferior. And so I don't want that. So I'll give you an example. As I stated before, a patient underwent mastectomy. This is a real case. I won't be divulging any names, of course. And I saw her in status check, and I realized that she seemed despondent. Now, her treatment was going very well. In fact, her skin was really not desquamating. We expect desquamation, meaning skin peeling, during the course of treatment, especially for chest wall radiation. But she was doing well. But she appeared so despondent. And I finally asked her open-ended questions, which I think, as we all know, allows you to just, then the patient is not quite sure where you're going. And so they will divulge what's really at the forefront of their minds when you ask an open-ended question. Mm-hmm. And when you ask a direct question, then they are they're more liable to actually answer that question and then decide that you are not interested in any other aspects of their life. And so she was quite saddened because she had lost her sense of identity, because she had a double mastectomy, and it was not recommended that she undergo a plastic surgery at the time. And so she felt less than herself, less feminine. Also, she was gaining weight because of the aromatase inhibitor or tamoxifen pills that are prescribed in the setting if a patient presents with, say, estrogen positive disease. So not only was she feeling, was her self-esteem decreased significantly, but she was also gaining weight. So all of those factors, and it may not seem important to some because we may think, well, she's being treated for cancer, and so that should not be her focus, which is exactly what she said. She prefaced her response by stating that she did not want to seem vain. But here's the problem. Whatever we're going through is real for us, right? So for her, this was devastating. It was really devastating, and it was affecting her. And it affected, what happens is when it's not addressed, then it bleeds into other parts of your life. It certainly bleeds into your marriage. It bleeds into how you perceive yourself and your value. And then it then bleeds into work and your performance. So it is important. Right. Whether or not her husband perceived her that way, right? It matters how she perceived herself.
Sure,
right?
sure.
Exactly.
Yeah.
And so I had to address that in a way that she could then process it and realize that her strength, the courage it takes, far exceeds what is happening now, and that eventually she will be able to recapture all of that all of the external things. But really what matters is how she is learning from this process, the intangibles that is so much more, they're so much more valuable. But when you don't see that because you have tunnel vision, you see, all you're seeing, and it literally, it's all that's in her mind. When she wakes up in the morning, she's scared to look in the mirror. Literally. I have patients who do not look in the mirror.
Oh, man. Yeah, it is such a difficult circumstance to be faced with.